everyone, on this episode of Coding with Kate, I wanted to talk about working in medical records, and I only wanted to discuss this topic because I received a comment. Someone was asking what it's like to be a health information clerk, medical records technician, medical records clerk, that sort of thing. What you all do in medical records, just a snapshot and overview. And I know I've talked about this before in update videos where I've sprinkled some information in there, or I've touched on specific topics in each video, but I don't have one video that discusses everything all together. So today I wanted to go through all of that, and I think it's good information because then you will have an idea of what it's like being in medical records, what you will learn, what you will do, and then you can get an idea of what other things you need to be doing to either get into medical coding that aren't covered in medical records, or if your dream job is to be in medical records in some capacity, you'll have an idea of what health information clerks or medical records clerks or medical records technicians do. So to start off, the medical records department varies depending on where you are. The various healthcare facilities, hospitals, etc., they'll have their medical records departments set up very differently from each other. And it really depends on what types of services are offered at that facility, the size of the facility, as in how many beds and how many clinics, etc., are within that facility. Also, are they more paper-based, or are they mainly electronic-based? Are they a hybrid of both? And that will really dictate what the health information clerks or medical records clerks do. So at my hospital, we're kind of a hybrid, but we're a little bit more paper-based than I would think we should be. Whereas another hospital that's not within our network, they are predominantly electronic-based. So their medical records department essentially just deals with, I assume, I haven't been in their medical records department, so I'm just making an assumption based on what I see. Their medical records department, I assume, would mainly deal with release of information requests, and then also the work queues that I assume deal with have the doctors completed everything they need to by the end of the encounter or the 60 days after the encounter, etc. Those sorts of things that I won't necessarily get into because I don't do that much right now with that. But I assume that's mainly what they do. So that would mean their health information clerks won't be doing a lot of the stuff that I do at my facility. All they would be doing is releasing records. So going through the medical record, printing out the documentation the patient wants or another healthcare facility wants, and sending it to them. And that is predominantly what they do, because everything else is electronic. So all of the documentation that the physician, surgeon, doctor, whatever would need to do is done on the computer via Epic or whatever their EHR program is, and it electronically gets connected to the chart, and there's no paper involved. But when you're in a paper-based facility or predominantly paper-based facility like I am, you need to get those hard copy documents, those paper documents, and scan them into the electronic health record. And then from there are other steps that need to be done before those documents are accessible to the physician and other departments that need it. So how electronic they are dictates what the health information clerks do. So you're going to see a lot of variety, and you'll need to do some research in the healthcare facility that you want to work with to see what do they do with their medical records. Are they electronic? Are they paper-based? And that will let you know what type of work you will be doing. So for this video, I'm going to discuss what we do at our facility since we are predominantly paper-based. And then you can get an idea of what that is like. And then from there you can see If everything's electronic, then these are the things you won't have to do. So in our facility, we are a large facility and we cover a lot of services. And our facility essentially is considered the hub, main facility, headquartered facility when it comes to medical records. So we have access to every single site that we have and all of the documentation that is obtained from those sites. So when we have release of information requests, they always come to us because we have access to everything. So since we are so large, we have a lot of things that we do, and we do offload some of our work queues and tasks to other facilities, but we predominantly do a lot of things and we cover a lot of services. So we aren't pigeonholed into just behavioral documentation or just ambulatory surgery documentation. We do everything. And since we have a large facility, we have, I believe, over 500 beds, so we have a lot of inpatient areas that create paper documentation. And that paper documentation has to get into the record so then it can be accessible to all the physicians, nurses, clinicians, etc. So we have to physically walk to all of those patient areas to get all of that documentation. And then we bring it back to our department where we go through the process of sorting, prepping, scanning, indexing, and then QA. Now that process essentially is taking all of the documentation, sorting it out to what we need to put into the health record and what needs to be tossed because it shouldn't be in the medical record. That's usually nurse handoff sheets or just informational sheets for the clinicians or surgeons, etc. It really doesn't pertain to the actual medical record. It's just what they use on the floor, and that's the only place they actually use it for. So we need to figure out what we keep, what we don't. From what we keep, we then need to sort it into what can be read by our barcode scanner and what has to be indexed manually. Now this step is because some forms are standardized and get a barcode for ease of access because we get a high volume of them. And there are other documentation that might be just specific to that one department or that one specialty or from the clinics that we do have in our hospital. And it's just something their clinic or office uses, but it doesn't technically have a standardized format, so there isn't a barcode attached to it. So since there is no barcode, we have to go through and manually say in our program, it is this type of document. And every single document should have a CSN or a contact serial number. So that is how the program associates it to a patient chart and then a specific encounter. So then when a physician comes in after the fact, they can go directly to that encounter to see what documentation they obtained or if they're looking for something specific. So if they know that they need the H&P from a specific clinic visit or a specific hospital stay, they can go directly to that CSN or to that encounter to find that documentation. So that is another step that we have to do in prepping and sorting, is ensuring that every document has a patient label, which will have the patient name, date of birth, their MRN, so their medical record number, and then their CSN contact serial number. And if they don't have a patient label, they will usually write the patient name, date of birth, and the MRN. Sometimes they just do the patient name and the date of birth. And at that point, we need to go into that patient's chart to find what the CSN is for that patient's stay or that clinic visit. We have to do some investigative work to figure out what are we going to scan this to. So once that is done, then it's time to scan. And we essentially scan everything on what's called OnBase. The full name is Highland OnBase, and that is for high volume scanning. So that's where we get the barcodes and the non-barcodes. So that scanner and that program can use those barcodes to associate document types, so we don't have to do that manually. and it will already start to associate it to patient encounters. And then the stuff that is non-barcoded is stuff that it scans in, but we have to go through sheet by sheet, page by page, and actually put the CSN, which will associate to the patient chart and the encounter. And then we also have to go in and put in the doc type. Now, once it's scanned, then we go through the indexing process of ensuring that the barcode read correctly and it's the correct document type and the correct patient encounter. And then we do the non-barcoded where we have to go through on our own. So once that is all done, then it goes on to QA, where that is a step where another employee will go through and verify that you put in the correct CSN, it's the correct patient, it's the correct doc type. And then they will also look at the image that is scanned to ensure that pages, the corners aren't folded over, that information or whatever's printed on the sheet is not covered up by something. So once that is all done, then we have all of the documentation that can be scanned via Epic. And in sorting, that is something you will do. You pull out all that documentation that can be scanned directly into Epic, which is all diagnostic documentation. So these are all forms that are diagnostic tests or procedures, services that are used to diagnose something. So this will cover lab tests, pathology, most surgeries, imaging, ECGs. You're going to have a lot of those things and a lot of other diagnostic tests that you may have never heard of, but these are all documents that get associated to an order, meaning the physician went in, created an order which is saying, I want these things to be done. I have to document that I wanted these things done. And then when those things are done, the results get associated to that initial order. And this is where you start to learn a lot about different types of services, procedures, and diagnostic tests, because most of the time, those result sheets, or whatever you want to call them, they might not have the exact test name, or it might not be the exact name as on the order, and you have to figure out, what is this order called? Is there an order already in Epic? And if not, I need to create an order for this. And then you also need to decide, is this from our physicians, from our facility or our network facility, or is this from an outside facility, meaning our physicians made an order because they wanted our patient to go to an external site, a outside provider site, to get this test done? Or is this incoming information as an incoming history? The physician has a new patient and they need to know what is their past medical history and what sorts of diagnostic tests were done to help them treat them currently. And when you start to figure out those differences, then you can start to figure out how to scan it, where to scan it into Epic, etc. And all of this is going to be very specific to your site. A lot of facilities will have different protocols and procedures for doing this sorts of things, but with our facility, we do keep a lot of documentation from outside facilities, and we have specific procedures for how that needs to get into the patient chart and what we need to name it, how we put the descriptions in. We get very specific. And you will find that a lot of facilities probably don't take documentation from outside facilities. As in, if the physician asks for information from a different site outside of our network and they get this documentation, they use it, and then it's up to us to toss it because we cannot have it in our medical record. And if they need that documentation again, then they can request it again. Some sites are like that. We unfortunately are not, so that means a lot of scanning in Epic. So at our site, we do a lot of Epic scanning because we get so much diagnostic documentation because we are so big and because we offer a wide variety of services. So some of the differences you'll see from site to site, facility to facility, is how much time the health information clerk spends on Epic and learning about different documentation and how to scan it, how to read it, etc. So that is predominantly what a day would look like. Obtaining documentation from the floor, scanning it in via OnBase, so the high volume stuff, or scanning into Epic. And we have a lot of other work queues that go on, but not everyone is assigned to them because it takes a little bit of training to learn some of those things. So we have a transplant clinic, we have oncology services, so we get documentation from them, and that has a specific procedure of what we do with that documentation and how we scan it into Epic if we need to. And then we also get a lot of lab documentation, so we have one dedicated employee that takes all of those lab tests, and they have to go through their own process of entering those results into the chart. I have never done that process, so I don't know how to accurately describe that, but we do have someone that does that. And then we also have employees that are solely working on work queues that are highly complex, and I've discussed this very vaguely, but I have brought it up. So we have initial analysis, meaning we have employees that go into a list that has all of the encounters that took place. Predominantly it's inpatient, outpatient procedure, observation, rehab, those specific types of encounters. And we need to analyze and ensure all of the required documentation is there and that it's signed. And the program, meaning Epic, will already assign deficiencies, meaning there is something missing or a step needs to be completed. Either the op report was not dictated yet, or it's dictated but it's not signed. Verbal orders were not signed. We are missing an H&P, or the H&P is not signed, or there needs to be a cosigner. It'll already populate what is missing in a deficiency list for that encounter. And then we, as health information clerks, have to go into the patient chart to figure out, was it misplaced, meaning was it assigned the wrong doc type, and that's why the computer or Epic did not realize that's what this documentation is, or is the process still being dictated so we know it's still worked on, so we can technically say this has been analyzed and it's complete. So that is a whole process that can be learned, and that's something that has to get done. Then we have a missing doc queue. I don't know what that process is like because I have never done it yet, but I assume it's, what do we do when we're missing documentation? How do we let the physician know we're missing documents, you need to do this? And then we also have, it's called a done declined list work queue. I don't know what that is. And then we also have a suspension list work queue, where if, I believe, a physician doesn't do something in a certain amount of time, I don't know if it's either dictating, signing, something like that, they don't do it in a certain amount of time, then they are up for suspension. And I believe that means that their license is suspended, meaning they can't practice until they get whatever worked out, I think. So those are the other things that can be done or can be trained when you are working in our facility, in our medical records. And then the other thing that we do is we predominantly do release of information requests. Since we have access to all of the site's documentation, we can then go into the patient chart and release documentation when it's needed. And we have our own copy service that is there Monday through Friday during business hours that deal with the high volume of release of information requests from either healthcare facilities, aka physicians, or from patients themselves. And then our copy service goes through that process of finding that documentation, printing it out, and then releasing it. And we have a module or a section of Epic where we have to leave a digital paper trail of what documents did we release, who did we release it to. So in the future, if the patient comes in saying, who did you release my documents to? My physician did not get those documents. Where did they go? We can go into their record, which will show what we took out, who we sent it to, and then we also have to scan in the actual request, like the paper request, and the confirmation of who we faxed it to or who we mailed it to. So there is that record. So if we need to audit that release, we can, and we know what was all released and who it was released to. Now on the weekends is a different story, only because we are not open to the public, so our copy service is not there, and we do not release records to the patient specifically on the weekend. We only do continuing of care, meaning outside facilities have our patients in there for an inpatient stay or an ED visit or whatever it may be, and they need records to help in the treatment of our patient. So at that point, they can just fax us the request or a fax cover sheet that has the patient info, what they need, who they are, their contact info, and then it will either be signed by the patient because they are capable of signing, or it will not be signed because they are incapacitated. So we know, is it authorized by the patient, or since they're incapacitated, it is automatically authorized because of their mental state, etc. And then from there, we can go into the same module and release all of that information and have that digital paper trail of what we released and who we released it to. So we cover a lot of things in our department, and we do a lot of things. Now, getting away from the nuts and bolts of those processes and those daily tasks, another big thing that you will come across regardless of what type of facility you are, either paper-based, electronic, hybrid, small, big, what types of services, regardless, you will have to know how to identify medical documentation, because you'll either need to search for it to release it, search for it to fix something on it, or to index it so it is placed correctly within the patient chart. So you will have to get acquainted with medical terms to help you figure out what is this document. You will have to know how to read those documents so you can find information that will help you decide what type of document it is or what type of description needs to be put in Epic. And those are the main things and the main skills that you will learn and will need when you get into coding or doing other things outside of medical records. So we get a lot of oddball diagnostic tests or services that we have never seen before, or at least the format we have never seen before. And we try to keep a grid that will have a list of all of these tests and what they are as far as what we will put them in, as far as what the order should be if it needs to be associated, or if an order is already there, what the doc type should be, because we do get a lot of the same documentation and it's easy to have a list. So then we can go in and say, oh, this documentation that says octopus on it, that's diagnostic ophthalmology. It is some sort of visual diagnostic test. But we usually get a lot of random ones that don't come in as frequently, so we don't have them on our grid, and it's up to us to look through it, see what the test is, what verbiage is used to help guide us into finding out what it is. And sometimes that comes down to it's something that came from another facility, so they have different test and order names. And then also, as you go through a lot of these diagnostic tests and other forms, you can start to research them to figure out the rationale behind why is this indexed as this sort of doc type. Here's an example. So we get a form from our inpatient setting called TEG analysis, and the image, I'll put it up on the screen, or at least a general version of it. It looks like a graph, and it has the shape of like a tuning fork, and then it has a ton of different numbers and things below it. And it looks like a diagnostic test, so you would assume this would be scanned directly into Epic and be associated to an order. But we scan it via OnBase, and it is not associated to an order. We consider it doc type of procedure perioperative. Now, when you look at the words procedure perioperative, meaning this test was completed during a procedure, and perioperative meaning it happened alongside or parallel to the procedure, but it didn't necessarily have any integral part in the procedure itself, meaning not every patient that comes in to have that procedure done will have this TEG analysis done. It's something extra that is technically separate from the actual procedure. Now, when you go online and you Google TEG analysis, you will find out that it is a test that is done shortly before or during the procedure, where they test the blood to figure out how quick the blood will clot and how long the clot will last before it dissolves. And this lets the surgeon and the nurses in the OR know, are we going to have a clotting issue once we cut into this patient? And if so, then we need to use these specific drugs to help with either a clot needs to be formed quickly, their blood isn't clotting as quick as we'd like, or the clot dissolves so quickly and then we're going to have bleeding issues. So we need to give them this drug that will help maintain the clot until the procedure is finished. So it isn't technically diagnosing anything, but it is informing the surgeon so they know what to prescribe during the procedure and what they need to be aware of so there is no bleeding issues during the procedure. So it's a lot of Googling these obscure documents to figure out what they are, and then once you can find out that information, then you can start using your problem-solving skills and analytical skills to figure out what do you do with it as far as getting it into the patient chart and what it should be called. And this is very important because once you scan it in, the physician needs to know how to find it if they need it. So if you are scanning in an imaging document and you scan it in as an MRI, but it was actually a CT, and the physician needs to go back and look at that imaging test or the results or the interpretation, they're going to be looking for a CT order, and they won't find it because you had mistakenly put it in as an MRI, and they won't know to look under MRI to find the documentation. So we have to be very accurate and ensure that we're scanning it correctly so then the physician can find it. And then throughout the process, you learn how to go in and fix some mistakes when things like that happen, or if you put in the wrong description, learning how to fix it, how to navigate Epic in that way. But overall, working in medical records, if you're in a department like mine, you will be handling thousands upon thousands of pages a week, and you will be looking at a wide variety of diagnostic and non-diagnostic documents, meaning documents that are used to diagnose a health problem, or a non-diagnostic document, meaning documents that are mainly for consent of treatment, consent of procedure, financial information of insurance is paying for this service, or insurance is paying for this prescription, things like that. You will be seeing a wide variety of those things, and you will be reading through this documentation to figure out what is this. And along with the non-diagnostic stuff, you will also start to see and get familiar with clinic notes, H&Ps, progress notes, and you will learn how to differentiate them, or at least per your hospital or healthcare facilities protocol of what they consider a progress note versus a consult or versus an H&P. And you'll be able to look through and read those notes to find those indicators of what type of documentation it is. Because sometimes you will have these documents that'll say H&P, but then when you read the description of the chief complaint or why the patient came in, it'll say patient came in for a follow-up. Well, our facility says an H&P is the first visit they ever have. They're a new patient. And follow-ups, anything after that is considered a progress note. And then we use consult when it specifically says consult on the documentation. So you will start to learn how to find this information or those indicators of what type of document this is, and reading through and knowing where to find that information or what a general format of that documentation is to help inform you on what type of document, what the doc type should be, etc. So you will get intimately familiar with medical documentation, what the format is, what is needed to make it complete, etc. And this all is important, especially when you get into other careers when it comes to like medical coding, registry work, etc., because you will be searching for and handling, at least digitally, these documents, and you will have to know where to find the information that you need. And you will already be familiar with the structure of these documents, or at least a general structure of it. So you will know, in general terms, where this specific information would be found within that document. And you'll also know, what is it? If I'm looking for imaging, I know I'm familiar with this EHR. I know that there's an imaging tab and there will be orders listed there. Or I know that I'm going to find this information in the media tab because it isn't associated with an order. Or I know that I can go directly into that encounter chart. So just that one encounter for that one date or that one length of stay, and I will find the list of everything that came up in that encounter or that length of stay. So hopefully that was a more complete look at what it is like to work in medical records and how it differs from facility to facility. If you have any questions, post them in the comments below. So if you have not done so already, subscribe to this channel so you get notifications on all the videos that I post so you're always in the know. Like I said, comment below if you have any questions or if your facility differs from how my facility is set up. Let me know. I'd love to know what it's like in other facilities that are different from us. And then also like this video if you enjoyed the topic of medical records. And I'll see y'all later. Bye!